Welcome, dear friends, to another session of Bless India Prayer Program and our health talk. Well, dear friends, we have another very interesting session. The other day, a friend of mine had called me and she said she wanted to call me so badly, but she forgot what it was about. And then, she went on to saying, am I losing my memory? This is one of the problems as we advance with age. We begin to think, are we losing our memory? Why? Because we can lose our self identity, we can forget who we are. And as Dr. Kuruvilla George, an eminent psychiatrist, led us last month on the signs, symptoms, treatment of dementia, a dreaded disease that seniors fear, that we could also have psychological, emotional, physical symptoms, and we can have problems with our caregivers and with our people in our own homes and in church, etc. So, and he also was telling us he has a real passion to help believers and Christians and people who love the Lord how to cope with such problems and to help them out of it with the help of Christ. So I want to introduce this eminent psychiatrist, Dr. Kuruvilla George, to you this evening. He hails from Singapore. He did his medical studies in India. He did his postgraduate in psychiatry in UK. And then he currently lives in Melbourne, Australia. Now, recently he retired as the Director of Medical Services from Peter James Centre, Melbourne, Australia, and as a Clinical Director of Aged Persons Mental Health for Eastern Health. And he was the Chief Psychiatrist in the Department of the State of Victoria from 2002 to 2012. In India, KG served as the General Secretary of the Evangelical Mission of Medical Students and Doctors, and he's helped out in mission hospitals and medical students and doctors, and that's how I knew him as a medical student. He'd also worked as a doctor in Operation Mobilization in their first ship, Logos, which is very interesting to find out. And then he had a passion to minister to people with the stigma of mental health and to remove that stigma, especially in the church, and to guide Christians to teach others how to help to remove that stigma and to help people with the stigma of mental health. So, Dr. Kuruvilla George, he's going to show us today talk to us about the Christian approach to dementia. So I welcome you all, and this is a very important talk, and I hope you will enjoy, and I'm sure you'll enjoy, and I would like you all to participate in the discussion following this. So, Dr. KG, the floor is all yours.
Thank you very much, Hansa. Yes, I will just share my slides. Now, as Hansa mentioned, so the last time I covered most of things to do with dementia in terms of the illness, the symptoms, the signs, the prevalence, uh, and how do we diagnose it, and what are things that we can do to try and probably cope with it, or if that what are the things that we can that is known at the moment that we can prevent dementia and etc. So we covered all that, but I'll just go through that quickly now, because this is a huge topic, as you all know, and also an increasingly important topic because people are becoming aware, because either people in their family or in their community, they're getting to know people who are suffering from dementia. And what do we do as people are living longer? It's becoming more and more evident in many of the people that we know. So the last time what I what I did was to cover the definition, and then we went on to very quickly. I'm going through. Sorry about this because these are covered. Prevalence of dementia, and as you can see, it is projected to be 140 million by 2050. 140 million people in the world suffering from that. And we saw that dementia increases with age, exponentially with age. And that's why now, because people are living longer and longer, we see more incidents of dementia. And we looked at various other key facts. that 60% of dementia sufferers live in low and middle income countries, and etc. So, as I said, I don't have time, unfortunately, to go through this. I'm just skimming through these slides. Um, and then we looked at some of the causes. There are we When we talk about dementia, very often people's mind, they think about one illness, and usually it is tied up, or people think about Alzheimer's dementia, which is the commonest. But there are 100 different medical conditions that can lead to dementia, and we break it up into dementias that can be reversed, dementias that cannot be reversed, and there are, just very quickly again, some of the uh, reasons, etiology, we say, the causatory factors or contributory factors towards dementia could be genetic, infections, trauma, subdural bleeding, nutritional, side effects to medication, metabolic endocrine problems, toxins, neoplasms are new growths like cancers, normal pressure hydrocephalus, organ failures, vascular, degenerative, chronic mental disorders like schizophrenia, bipolar depression can also give rise to a picture of dementia. So we looked at some of the causes, and then we concentrated on degenerative. What are some of the non-reversible types of dementias? And we looked at Alzheimer's is the most common, but then there is vascular, that is due to blood vessels in the brain being blocked, and that means death happening to the brain. Multiple vessels in the brain becoming blocked with atherosclerosis. Then there also can be a mixed, both the Alzheimer's type and the vascular going on at the same time. Then there's another one which is called Lewy body dementia, which people became aware of more over the past 20 years, 25 years, and more now, because people are aware. It's not that it's new, people are aware, so they are diagnosing it more. Then Parkinson's, we all know about Parkinson's and know people who have suffered from Parkinson's disease. Parkinson's disease is a dementing illness. Earlier on, you have more movement disorders, but as the illness progresses, you begin to affect the higher centers, giving rise to memory and other problems, cortical problems. Then there's something called Pick's disease, then alcohol-related dementia, then infective dementias from infective prions, we call it, meat that you eat, and especially in UK, it was first described what's called a mad cow disease, and then other degeneratives, HIV, it can give rise to. And then also increasingly people are becoming aware the chronic head injuries we used to call punch drunk syndrome for boxers, but now increasingly many contact sports like rugby, like Australian football, American football, people are beginning to be diagnosed with dementia later on. Then we looked at various symptoms and signs. I'm not going to go through all that. And we said also 70 to 80%, that's where many psychiatrists then become involved, suffer from what's called behavioral symptoms, which include restlessness, agitation, wandering, sundowning, sleep disturbances, vocalization, aggression, or psychological symptoms like anxiety, depression, psychotic symptoms. And it's quite common. And we talked about community surveys that have been done in Britain, and showing the incidence of all these different behavioral and psychological symptoms. And an Australian study, a huge study that was done to 10,000 residents in residential homes, again showing the incidence of all these symptoms. Now, I understand, as was mentioned, this was not recorded. We are looking at whether it can be recorded and given to people who are interested later on, all this. Then we looked a bit more into Alzheimer's, which is the one, which is the commonest, and people all think about dementia as Alzheimer's. And we looked at what are some of the causes of Alzheimer's. We still, all that we know is there's degeneration in the brain, and there are materials found in the brain due to degeneration that's happening in the brain cells. But the question is, why does it happen? It's still $1 million question. Why does it happen in some people, not in others? Could it be genetic? Could it be nutritional? Could it be infections? Could it be toxins? Could it be stress, depression? Could it be Down syndrome? There is a relationship between Down syndrome and Alzheimer's dementia. So what is it? We still That's the million-dollar question. We still do not know for sure. There are all kinds of theories. Then I won't go into that. Then we looked at things that might be confused for dementia, what we call pseudo dementia. Uh, Delirium, very old people, because their brains are degenerating, any kind of insults to the brain. In a urinary infection does not infect you and me, but an older person who is already having a degenerating brain, once they get a urinary infection or a chest infection or even a constipation, I've seen people with constipation who then their brain becomes totally confused. We call it delirium. And that can be confused as with dementia very often. And that's where a special medical person needs to diagnose, is this a delirium or a dementia? And a delirium is called acute organic brain syndrome, while dementia is called chronic organic brain syndrome. Then depression in old people can often be confused, because people who are severely depressed in old age can behave as though they have got memory problems, they are confused, and that can often be confused and cause for pseudo dementia. And you can Depression in older people can mimic dementia. Anxiety in old people can mimic dementia and can make memory problems and other problems worse when you have a lot of anxiety. And then also, there's what's called benign memory loss of aging. Old people without dementia, as we get older, there can be problems with their memory. Like many of us who are getting older will realize, we can't remember names as well as we used to. We can't remember maybe things as well as we used to. That is not dementia. That's what's called benign memory loss of aging. Then we looked at how we diagnose dementia. As I said, I'm not going to go through all that. And then we looked at how fearful, the British YouGov poll did a survey, and it showed, this was very interesting, 31% of respondents fear dementia the most, with 27% fearing cancer and 18% fearing death. So people in you British government YouGov poll found that more people fear dementia than even cancer. Um, and among retirees, again, you saw that dementia was high up in what they feared. So then we looked at management, diagnosis, investigations, etc. I'm not going to go through that. And then uh, complications, etc. So I'm going to jump all that. And then we looked at how we can prevent, what are the things that we know currently that we can do. Uh, Nothing again for sure. These are things, important lifestyle practices that we can do, reducing stress, sleep deprivation, smoking, low levels, general anesthesia, hypertension, all these things can worsen um, and to prevent dementia. Okay, so now today I'm going to see. When I came back 2 weeks exactly today, I did a workshop at the Center for at the Melbourne School of Theology, the Center for Theology and Psychology, and the workshop was 4 hours long. So we are doing something now, constricting all that. It has got to be, there's so much of material. It was a 4 hour workshop that we did, and people who came were the feedback has been quite good. And then I visited my mother, who is 96 in India, just a month ago. On my way back, some of my relatives in KL wanted me to visit them. I've not been there for years because the last time I was before COVID. So I went there, and they wanted me to do a seminar. So there's a lot of on dementia there in their church. There's a lot of interest because, as I said, more and more are people are becoming aware of this problem, because either they have personally been involved caring for someone in the family or in the church or in the community. Now, this is something that I will do in a workshop. a case study and then get people to discuss. So, just to get people to think about very briefly, this is a case study about Mary. I'm going to read that. You can follow it. So, what everyone knows about Mary: Mary is 82, has been part of your local community all her life. She was always very well groomed and socially adept, welcoming new people to your church and offering to help with everything. That was who she was. But what you have noticed about Mary recently, Mary rarely comes to church now because she struggles to be ready on time. When she is at church, she is less smartly dressed than she used to be, and she appears to struggle with following the service book. She rarely talks to people after the services anymore. She waits for other people to approach her first. What you can't see, Mary is having trouble remembering how uh, to do basic things like making a cup of tea or how to use her door keys. She often talks about her childhood, yet may forget what she did this morning. She feels overwhelmed in many social situations and finds it difficult to put sentences together. She forgets details that she always used to know, including her current appointments. She enjoys listening to recordings of him singing still. She enjoys that. What Mary will freely tell you if you ask her. Mary would love to come to church more often, but she thinks her children will be too busy to drive her. She doesn't want to burden them by asking them for help. She wishes that her children would visit her more. She can't recall when they last came to see her. She's forgotten. Mary quickly changes the subject and tells you stories from her childhood. When Mary was a little girl, she loved trains and ships. She doesn't feel that children missed out by not having computer games or mobile phones. She and her friends used to play at skipping and hopscotch, and her brothers built a treehouse. Mary used to borrow piles of books from the library each week, and it only took her 2 days to read all of them. That was before she began to have memory problems. What Mary wants to hide. Mary always prided herself on being competent and independent. She is embarrassed about needing so much help just to do ordinary things. She does not want you to know just how little she can still do for herself. She feels ashamed and she can't remember people's names at church and feels like she has nothing to contribute to society anymore. Is it something that you have come across, somebody like that that you have come across, or similar to that in your family, in your church? And then at workshop, we would then go through questions for groups to discuss. We don't have time for that. But what I would like you to think about is question number 5. And that's what we are going to concentrate on now after this. What might she need most from her church family? What might she need most from her church family? A lady like Mary in your church, in your faith community, in your fellowship, in your friends, a group of friends. What might she need most from her church family or community? As you consider these questions, I'm going to just share with you a couple of, probably 3 things for you to again ponder and consider. It's a story that I recently read about a couple where the husband was suffering from dementia. When the wife took her husband to a day center for people suffering from dementia, this is actually a day center for people suffering from dementia so that they can help people with dementia. And shared her concerns. So the wife shared her concerns to a care worker about the changes in her relationship to her husband. The care worker responded, "You must just divorce him." The care worker's logic was presumably that dementia had changed the husband and he was no longer the man that the wife had originally married. And so she was justified in divorcing him. This comment comes from the false premise that the husband has become a non person due to his dementia, and divorce therefore makes sense so that the wife can start life all over and be happy again. Just for you to think about that. The second story is about a care worker in a local psychiatric hospital this time, whose response to the wife about her husband suffering from dementia was that it was time to begin consideration of euthanasia or physician assisted suicide. She mentioned it as time to think about the blue pill. And the blue pill means, the pill that will be given to put that person to sleep. The assumption here was that being dead is preferable to being alive with dementia. And this assumption is not only among non Christians. Am I right? Well, let me tell you this, the third, which for us Christians brings home what I'm trying to say. Well known tele-evangelist, some of you would have heard about him, called Pat Robertson. Pat Robertson caused controversy by making remarks about dementia during an interview on his television program. Robertson responded to a caller who asked how Robertson would advise a friend whose wife had severe dementia and was unable to recognize his friend. The caller also informed Robertson that his friend was bitter at God for allowing his wife to be in that condition and had started seeing another woman. Robertson's reply stunned many Christians, and especially those from the evangelical community. This is what he said: "This is a terribly hard thing. I hate Alzheimer's. It is one of the most awful things because here's the one, the love one that one loves. This is the woman or man that you have loved for 20, 30, 40, or 50 years, and suddenly that person is gone." I know it sounds cruel. This is what Pat Robertson is saying. But if he is going to do something, he should divorce her and start all over again. But to make sure that he's saying, so that his guilt is taken care of, but to make sure that she has custodial care, that she's being cared for very well, somebody looking after her. When the co-anchor, the other person on the program with Pat Robertson, wondered whether this advice was consistent with the marriage vows till death do us part, Robertson added, "This is a kind of death." Now, the key question is whether such an advice would be given. This is what we have to think, to a spouse who suffers from cancer or Parkinson's or a serious stroke. Why is dementia seen or considered as essentially death? Why? Why? That's a question. So let me go on. What should we as Christians, what should be our perspective on dementia? The prevalence of dementia, as in the first talk I gave, is increasing. As Christians, we need to have an understanding for our sakes and the sakes of others, our family, our friends, and our faith community. Dementia was not part of God's plan at creation. It was not part of God's plan. Remember that. It was sin, as we know, that led to disease. We all know that. And all creation is susceptible, following that original sin, to corruption, decay, and death. It was not God's plan. It is because of what man did. Humans are created in the image of God, and dementia does not diminish this. I hope I can make this point. Dementia does not diminish this. Just like a child or a person who has got, mental subnormality, that child or that boy or that man, the woman, still has the image of God. God has a purpose in all things, including dementia. Ultimately, all of us are washed in the blood of the Lamb, whether suffering in this world with cancer or dementia, and we have been promised that we will be like Him. We will be like Him. So, God knew us, it says in the Bible, we can read in Psalm 139, when we were in our mother's womb. God's plans, again, we read in Jeremiah 29, verse 11, are to prosper us. That does not go because we have dementia. Neurological decline cannot separate us from the love of God. It cannot, just because our neurology has deteriorated. Lives touched by profound dementia continue to have meaning and purpose. Dementia, yes, what Pat Robertson said is right. It's a devastating illness. But this is where the difference is. But these people remain tightly held within the memories of God. They are still held in God's work memory. They are there. As before, they still are there. And it is our our humanness, our idea of what human beings are, the nature of ourself and self-fulfillment that need to be recreated. It is not God's. It's our ideas that are wrong. And we read in Romans, neither death nor life, nor anything else in all creation will be able to separate us from the love of God in Christ Jesus our Lord. So we need a paradigm shift when we talk about dementia. What is the paradigm shift we need? Dementia is more than neurology and neurological decline. Yes, there is degeneration in our brain cells, but it's more than that. It is a complex psychological, social, and neurological disorder. Like many mental disorders, whether it be schizophrenia, bipolar affective disorders, it's a complex disorder. Dementia does not entail a loss of mind. Others, other people presume that we have that man or that woman has a loss of mind, and then we project all kinds of responses to them, thinking that they don't have a loss of mind. How do we know that that person still is not able to know who you are, what is happening? How do you know? We are presuming. Dementia does not entail a loss of self. Self remains intact. Any loss of self relates to failure of the community. We are the ones who often the way we react to them that makes them lose their self. Some of the, I told you about the behavioral and psychological symptoms, whether it be agitation, whether it be aggression, whether it be noisiness that many people with dementia exhibit. Why? It is their response to what they see happening to them, you see, and they feel they're not getting the attention, or that somebody is now just wash them off. Then the only way they can get attention is being noisy, or being, they see somebody coming to them, they feel there's a threat to them, the way that they are coming to them without explaining properly what is being done to them. Carers just go and just take their clothes off and wash them. They see it as a threat, so they become aggressive. They are defending themselves. Many of these symptoms that we see. So the behavioral and psychological symptoms are not caused by failing neurological process alone. Yes, it is partly due to that, but it's also a reasonable response very often, or responses to difficult, frightening, and frustrating situations that many of them are facing. If these responses are not understood by us, it causes real difficulties for the caregiver and the care receiver. That's where we need to have a bit more understanding of this illness and what we can do. So, in order to understand the experience of dementia, we need first to understand the person's story. Who is this person? What kind of a person? What was he or she like? What is their story? When we grasp both the disease and the story, the true structure and nature of dementia begins to emerge. why that person is behaving the way that he or she. There might be trauma in the past in their life. Do we know that? Could that be the reason why they are reacting the way that they are now that they are dementing? Neuropathology, yes, again I say what's happening in the brain has a significant place, but we need to take cognizance of the environment, the relationships, the attitudes, and the values that surround a sufferer. This understanding then provides an important place to begin to reflect on the theological and pastoral dimensions of dementia. So, how do we respond then as Christians? How do we respond after knowing all this? See, unfortunately, aging is seen as negative in Western cultures and increasingly so, unfortunately, in Eastern cultures. Even in India, now you go to Kerala, for example, so many old people living in these big houses that have been built by their children, how in the Middle East or in the West, living on their own, left on their own. Um, well, they are old now. I mean, what am I going to do? I'm living my life here. So, as seen as negative, not only in the West, it's happening in the East increasingly. And hence, people begin to think about euthanasia, ways out for these people, or assisted dying, another way of talking about euthanasia, legally, so that it's not seen as euthanasia is assisted dying. And also increasingly healthy aging. What are we trying to say? What do we mean by healthy aging? Again, trying to cover up that we are getting old and that uh, we don't want to be old. We don't want to have all these problems. So we talk about healthy aging. Even churches and Christian communities focus on young people and young families, and the elderly are considered a burden. The Christian vision of human beings being created in the image of God here is revolutionary, created in the image of God. And that image does not disappear, does not degenerate, does not it does is not destroyed. It is a basis for caring and is a foundation for ethics. It's a revolutionary. This idea as Christians that we have, let's not lose that human beings were created in the image of God. And without such a vision, caring becomes a mere transaction, and the ethics and the value of care disappears if we don't have that view of human beings made in the image of God. Um, as infants, remember, we are dependent, and nobody questions that. Here's a child, we have to do everything for them. They're incontinent. They have to they have to do everything done for them, fed them. We accept that as parents. They are dependent, they're immature, and they are learning. As we age, this is a cycle. We become dependent, we become decrepit, and we die. So this is a cycle. But why do we treat the elderly differently? We are designed to be dependent as human beings. You see that independence is independence. We are dependent. Human beings are dependent. Dependence is not a result of the fall, it is part of our creation. From the very beginning, God created not an individual, but a community. Adam and Eve first, and then a community, because we are created to be dependent uh, human beings. Hebrew word for human is Adam or Adam, and it comes from Adama, the ground. That's where it comes from. And we are groundlings. We are from the ground. We are frail, we are dependent, we are limited, we are vulnerable. That's who we are. And we are created not only to be dependent to God, but to one another. Let's remember that. We are created not only to be dependent to God, but to one another. When we begin to get all these things in our mind, our whole idea of dementia, about caring, about dependence begins to change when you look at this from a theological point of view. God has placed us in families, including Christian family. linked together in mutual dependence. We can read that in Galatians 6, verse 2. We should see old age and aging not negatively, but see it as part of life and not feel guilty of dependence. Even in dependence and disability, we can live fruitful and God glorifying lives, as we read in 2 Corinthians 4, verses 16 to 18. So, when it comes to caregiving, what we have is the example of Jesus. Jesus always had time for the sick and the suffering. We know that. He gave up his position to be like us and experience pain and suffering. Whenever a person came with a need, he always had the time. He never said, I'm busy, go away. Always had the time. And as when we talk about caregiving for people with dementia, there are the biological needs, food, exercise, health needs, the activities that they need to do. That's often the need that many carers have to look after for those people that are going through dementia. Psychological needs that we have to give, gifts of time, focus on the person. Very often that many people who are going through dementia, what they need is just you, your time, being with them, learning to communicate, autonomy, dignity, finding meaning, um, social needs, company, to be understood, accepted, and their privacy, and spiritual needs, reinforce love and acceptance of God, reading the Word of God, prayer, singing. Many of them, it's interesting. They can remember songs when you start singing to patients, people who are going through dementia. They can start singing with you. The memory of the songs are still there. Church and fellowship groups, when able for them to come and be part of that. So again, even if you have questions, you can ask. But these are some of the challenges that caregivers have. Many people who are going through dementia might have angry outbursts. They might accuse you for things that you have not done because they think it has been, they've lost things, or and then they have to find a reason for that. They start accusing you, become suspicious. They lose interest in things and become apathetic. They are unable to initiate things, they also begin to have loss of inhibition, saying things and doing things which they never would have done in their life before, because now their brain degeneration is taking place. They become slow and retarded, some of them. Difficulties in communication, you can't understand them because they find it difficult to find the right words. Shadowing, because again they're frightened to be on their own. They follow you wherever you go. That's called shadowing, because they are anxious about being on their own. Making messes, we know that when they're eating, there's mess. Toileting, there is mess. These are challenges. Sundowning, they become more confused when the sun goes down. When it gets dark, they become more confused. So it's called sundowning. Many of them, they are sleepy during the day and then they are awake during the night. Sleep disturbances that keep you awake, and lack of appreciations. Obviously, you do all the things, very often they can't appreciate what you're doing. So you look at that, the next to it, it says 14% of caregivers have said believe their physical or mental health is not good enough to provide care. 27% delayed or did not do things for their own health. They didn't take care of it. 6% said caregiving interferes with their ability to take care of themselves or their daily activities. So, impact on caregivers. Most often, the caregiver is either a spouse or daughter in law, or sometimes a son or a good friend. So it's either a husband or wife, daughter in law, son, or a good friend. Caregiving a loved one is never chosen by the person or often anticipated. It comes. And when it happens, it is often at a great cost or sacrifice to the caregiver. We know that. The patient is not the only victim of this sad disease. Caregivers are also victims and often even more affected in several ways. Uh, Physical health impacts due to stress, lack of sleep and rest, poor diet and exercise, reduced immune response, physical injuries, Mental health impacts due to stress, worry, anxiety, depression, fear, grief. Social impacts due to isolation and lack of social support. Financial impacts because they can't work, or the amount of money that is needed for the health care of the person who is going through dementia. Spiritual impacts, they can't probably have their quiet time, go to church, go to their fellowship groups. That impacts on their spiritual aspects as well of their life. So these are all impacts. Now let me just show you here, rather than me just talking, a little video. I hope it works, uh, of some of caregivers telling their challenges.
Now, how many interviews have you done before?
None.
Beautiful.
Hard to know where to put your hands. Like,
What was the question?
What have I learnt about myself?
I've learned that it's out there more than you realise.
That it can happen to anybody.
I've learned that there's lots of different types of dementia.
Alzheimer's is not like screaming, ah!
Live with dementia. Well, there's all sorts of things you can have that is good.
And have a lot of fun, actually, at times.
I go to a church and I just enjoy being with all those people because they look after me and they care for me.
And we were all enjoying ourselves and having a great time. And I turned to the guy next to me and said, you know, I'm starting to feel sorry for the people that haven't got dementia.
Having David, my husband, with Alzheimer's and being diagnosed the 2.5 years ago, my role changed.
I thought I would cope with this better, but I hadn't factored in the 24 hours a day, and that's challenging.
I've learnt that I'm very short on patience sometimes.
Answer the same question over and over again because it's the first time they've asked it in their head.
Misplacing things, forgetting to do things. It's the Alzheimer's.
I'm trying to put myself in his position, and I wouldn't want to be there.
I've been surprised at my feelings of wanting to care for him and standing up for him, and I feel a wee bit like a mother tiger with her cubs.
That I can do a lot more than I thought I could. That I cry a lot, sorry.
You take on everything as a carer, 24 hours a day.
Because your days have changed, your life's changed.
I don't know whether I like it. Yes, I'm glad I can do it. Otherwise, I'd just be walking away from him.
Just learning how to live with this, deal with it. It's going to be a long road.
He may be different, but he's still the same person.
That they're normal people, they have feelings. It's not their fault that they can't remember.
And if you take the time to chat and take the moment to give him the opportunity to find the words, you'll see that he's still in there.
For him, he amazes me because he doesn't seem to be angry or frustrated by it.
Probably learnt to cope a bit better and not sort of worry about things so much.
I just want to make it as easy as possible for him to get through this.
Look forward rather than look backward.
Don't know if I can, but I'll give it my best shot.
I just enjoy life and always have.
Right. There are other, because of lack of time, there are other videos as well that I could have shown, but I want to give you more time for questions. So church, how do we respond as a church? Recognize the importance of our senior members in our church. There are not many churches that are doing it. There are some that do have seniors groups and seniors services. I hope that more of our churches, like young people's ministry, that there will be more and more people, more who are concentrating on senior members, have a special ministry for senior citizens. Pastor leader, having a pastor who is dedicated for the seniors. We often have youth leaders, but do we have leaders for older people? Team for visitation. This is a great service that we can have. Increasingly, as people are living longer in India, a team for visitation, home, hospital. Like in Kerala, there are more and more old people's homes, teams that can go and visit and minister to them. Team to assist with practical needs for seniors, shopping, transportation, home services that we can be doing. This is what we are called to do as Christians, not just to go to church to worship on a Sunday, sing a few songs. This is what church is, what a faith community is. Train members to assist with emotional needs of both the person who is suffering from dementia and the carer. The carers often, after the workshops, one of the things that the feedback was, oh, we wish there was more said about how we can help the carers of people who are caring for people with dementia, the social needs, spiritual needs. To give seminars like this, talks and workshops. How many churches, it's a constant challenge that I have trying to get into church and saying, we have this resource. Please open your church up so that we can talk about this. Uh, Churches, I mean, it's so difficult to get into churches because churches are very protective as to who is coming and talking to their churches. Are you from the same background? Yeah, are you a member of this church? If not, they feel they're going to come and give theology which is against them. So sad, I'll tell you. Assistance for caregivers, practical support, emotional support, and prayer. And what there's dementia friendly churches. This is from UK. There was people with dementia may not remember activities they have been involved with, but the feelings they experience will remain. There are many small things we can do to make our churches more dementia friendly. Encourage members to wear clearly visible name tags. When we have more older people, many of them can't remember your names, then they feel embarrassed they can't remember your name. Is good probably to have name tags for people when they come to, people in churches. Print off PowerPoints when there are talks and other things being given. Older people can't remember. Maybe printing out notes and giving it to them. They can read it in their own time later on. Encourage signage in churches, clear and easily. This is where the toilet is. This is where the quiet room is. This is where you go. These are things that we should be doing more and more in our churches in India. Set up a space where a person with dementia can retreat. If things become too much for them, the worship or the noise, they can go to that side room and sit so that when they feel overwhelmed and not feel guilty about that. Pray for people like that with living with dementia. Prayer groups that when people are in those rooms, you can pray with them and sit with them. Whether ask a person with dementia whether they would fold, so they feel useless. They might have been active in the church, doing different things in the church, welcoming people or whatever, but now they can't do that. But there are other things they can do. For example, they can fold church bulletins, ask them to do that, and they can do that. A simple task like that. This type of contribution can have a powerful impact on that person's own self-worth. Be flexible to help people live with dementia feel supported and encouraged. Something that has been enjoyable once may not be on another day. So be flexible. Think what might be the person now that might fulfill them or encourage them, or they might feel encourage and enjoy. Constantly think about what I'm trying to do is get people to think more about older people in our churches, people with dementia, people with difficulties like this, how we can be more dementia friendly as churches and faith communities. Now, before we close, I want to just put this slide up. This is, again, something that I read recently, written by an American Christian physician. Very, very impacting. I found it. I hope you find it interesting as well. My mother, his name is Olvier, he's from America. My mother suffers from severe dementia. She often seems to understand what we say and who we are, but cannot speak coherently. As children, we want to visit often and give her moments of joy. Yesterday, my sister told her about one of her friends who was seriously ill. Mum immediately bowed her head and began, "Oh Lord, you are the one we can come to in our need." This very severely demented lady doing that. My mother can hardly put a sentence together for her kids. But when she prayed to her father, her clarity returned. We talk about the value of life. God keeps my mother in this life for a reason that is worth her suffering. Hearing of my mother's prayer has been of immeasurable value for us, her children. My moments seeking to bring joy to her life have been a struggle, yet in a godly way have changed me forever. And I would not be surprised if God did not respect my mother's prayer for our sick friend, poured out from a soul clouded by broken neurons far more than my own prayer would have been. As human beings, we cannot grasp the value of all that God is doing in a life, regardless of ability or disability. God holds the only measuring stick of our value, fashioned in love and marked with eternal numbers. His calculations ignore the measuring sticks of the world that might well decide to move my mother on more quickly or ignore the man born blind for God's glory. Our task is not to do the measuring for anyone we meet, but to trust the measurer and hold in awe the person he has set before us. What a powerful little reading that I read that made me think and become emotional. Well, thank you, dear friends. I'll stop sharing and uh, I will open it up for questions, comments, or whatever you have.
Thank you, KG. It was so powerful that, I think we're all stunned with that last portion that you read. It made us very emotional too. Yeah, one of the questions that I do have is when older people, we notice they become stubborn, and we don't know if it is part of their mental changes or what it is. Now, if we have property with them and we want to decide whether we want to sell it and do something, they will not sign. They will not want. They want to hold on to property that is useless and it is kind of a white elephant and we don't know what to do with it. They don't want to take any decisions. In such a situation, what do you do?
Yeah, so I would suggest, I mean, again, there are many things that we can talk about. I think these things are also covered when we talk about things that we can do proactively, is to have what's called power of attorney and medical power of attorney is done more in advance rather than waiting for uh, your parents or others coming to that point where they can't make that decision and becomes difficult. So earlier on, when they are able to have those discussions, it is good to make that kind of documents legally, so that when we know that they can't make the decision, it's already there that can be enacted. So that can be done legally. So that is something that I would advise well in advance. My wife and I have done that already, done our wills and done, if something like that happens, what should happen. So it's something for us all to think about for ourselves and also for our parents and our aging relatives. Because as you said, I mean, as we begin to get older and if there are cognitive difficulties that are happening in our brain due to neurological deficits, decision making becomes more difficult.
Yeah.
Because of various reasons, they become more suspicious, they become more defensive, and so you find all those kind of reactions that you were talking about. So it is better to do that before those things happen. And yeah.
So I'm in Singapore and I really enjoyed your talk. I just wanted to share a personal experience. I'm the doctor for my daughter's grandmother in law in Melbourne. And over the last 1 year, she has deteriorated mentally. She's 86. And last Friday, the family said she's having some kind of skin lesions. Can you come and see her? So I went to see her. When I have seen her in the past, my God, She prays so powerfully, so full of the Holy Spirit. But when I went to see her, she was repeatedly taking notes out of her wallet and counting it. And we are standing there, her daughter and me are standing beside her bed, but she's not aware of what's going on. And the family has told me that she is deteriorating in her mental state. What I wanted to say is, it was so painful for me because, the depersonalization that happens in people who were such powerful prayer warriors and, such amazing people of faith. And then when they get the dementia, there's such severe depersonalization. It is so hurting for the people who are watching them on a daily basis. I worked for 5 years in geriatrics at the Flinders Medical Center in Adelaide. And, sir, I wanted to say that I became so depressed as a trainee that I said I can't continue because, when we go on rounds, we find the patients totally in their excrement, totally, out of whack. On one occasion, I saw a man bashing the nurse on her left side of her face. She fell to the floor. We rushed and helped that nurse. Later on, she went on work cover leave because she had a head injury. So, you imagine, because as you rightly pointed out, they are not aware of what they are doing, and then they may injure the family member. And then, the family members don't understand why they are doing it, and that brings bitterness, anger, and it's a very complicated situation, especially in Australia. Such a severe incidence and prevalence of dementia. It is very, very tough. I used to visit nursing homes, but now I stopped because I'm being very honest with you, sir. It was very, very difficult for me to see the state of people with dementia.
Yeah. Thanks for sharing that. It's certainly, yeah, it's a challenging field, but a very needy field, I would say. More, I think it's, for example, when I was in KL, there are there are hardly you can count the number of geriatricians. So that's why, there is a great need because people are not being managed properly because there's a lack of that specialty. They're not getting the best that they can because that is not there. So I would really be encouraging. I mean, this is where, uh, yes, there are fields that we go into as doctors, which we feel might be easier, but challenging fields like mental health, geriatrics, palliative care. These are areas that we can make an impact if it is challenging, but at the same time, we can make an impact. That's my feeling. But certainly it's challenging. But yeah, as far as did you say it was your mother-in-law who is in Melbourne?
My daughter's grandmother-in-law.
Oh, daughter's grandmother. Yeah. But if there has been the only thing that I would like to say is if there has been a sudden change in her, you're saying that she was able to pray until this recently. If there's been a sudden change, then you'll be wondering whether there's something else going on top of the dementia. As you know, you have worked with old people. Is there now a delirium on top of the dementia, which has made her more confused than she should be at this stage? Because as you know, dementia is a gradual progressive condition, but if there's been a sudden deterioration, we always wonder whether there's something else going on top of the dementia.
So we are doing bloods on Monday
Right.
because those skin lesions also are very mysterious.
Okay.
Nodular lesions, I know.
Yeah.
So is it a manifestation of something going on underlying?
Okay. Yeah. So there might be something going on. That's right.
Yeah.
Yeah. You're based in Singapore now or in
No, sir.
Adelaide?
I came for an
Ah,
international conference,
okay. So, but you're based
but
in Adelaide.
oh no, I'm still based in Melbourne. I'm Pratap
Oh,
Philip. You know me
Pradap.
well.
Okay. Pradap,
Yeah.
okay. Sure. Sure. Yes.
So
Happy
when I
to.
saw this, when I saw you, I couldn't miss.
Okay, right.
listening to you. I always enjoy listening to you, sir.
So happy to talk to you further. If you're Pradap, contact me. I'm happy to talk to you further about the person you're talking about. If there's anything I can
Sure,
advise,
sir.
I'd be happy to do that. And the
Sure,
other
sir.
thing is, many of you know that I've written a couple of booklets. One is a Christian perspective on mental
Yeah.
health and suicide.
Hi, I'm.
And the second one is, if I can just finish, Supriya. Second one is about uh, on stress and grief. So currently, I'm writing about older persons and dementia. So which I hope I can get printed at the end of the year, because I get printed when I go to India. It's cheaper, and then it will be made available for everyone. So mainly about older persons' mental health and dementia, focusing on dementia. Any other questions or comments? Feel free.
Yeah.
Oh, Supriya, yes. Sorry, I
I'm.
interrupted.
Yes. Hi. Good evening. I'm calling from in New Delhi. I have a question. Like dementia is usually associated with people who are in a senior age. So is there an age bracket where it starts for this kind of thing? That's my first question. Second is, if at all the same symptoms prevail in people who are younger, let's say forgetful, not coordinated, do we call that also dementia?
Okay, so that's some of those things I covered in my first talk, which I sort of skimmed through today because we didn't have time. So in the first session, I covered some of that. So dementia is a broad term. There are so many different types of dementia. And
Okay.
very often when people talk about dementia, they think about Alzheimer's dementia, which is only one type of dementia. There are, as I said, 101 types of different types of dementia. So when we talk about even Alzheimer's, the interesting thing is that when Alzheimer's dementia was first described by a man called Alois Alzheimer, he first described it in young people. So, but then later on, we began to realize that it is an illness more common in older people as people were living older. But initially, it was described, and so we now break it up into pre-senile dementia of Alzheimer's type and senile dementia of Alzheimer's type. And when we talk about Alzheimer's, we know that as you go older, the prevalence of it increases. And it's quite easy. We used to teach medical students and psychiatric registrars, where people between 60 and 65, it is about, we talk about 2 or 2.5% of the population suffer from that. And every 5 years, the incidence of Alzheimer's dementia I'm talking about doubles, right? So every 5 years it doubles, and so that's why as you get older, the incidence of Alzheimer's dementia goes up as you get older, and that's why now, because people are living longer, we are seeing more and more people with Alzheimer's dementia because of that. But other dementias, there are so many, as I said, different types of dementia that can be there in young people. They can be in older people. It doesn't have to be just related to age.
Hansa, I have one question.
Sure. Please go ahead, Mega.
Dr. KG.
Yes,
it was a very interesting and enlightening talk that you gave on dementia. I just want you to sort of say something. I don't know whether it's a very strange question. What is the place of what is it, the spirit possession? They say, they have been possessed and so on. I think it's sort of mentioned very much also in the Bible, and people also talk about it nowadays. What is your opinion?
Well, you're talking about dementia and demon possession.
Yeah. I mean, mental illness, sort of, generally.
You're talking about mental illness as a whole or about dementia?
Well, it could be dementia, it could be aggressive behavior.
Right.
He's wondering, how do you differentiate between dementia and spiritual possession? I mean, so demon possession. Is that what you're saying, Mega?
Yeah, that's right.
Yeah, well, I mean, dementia, that I, I think there'll be less problem in distinguishing dementia and demon possession because once you do all the, the dementia screen, the screening, for example, scans and all that, you can see that there is degeneration of the brain, and that's why all the symptoms and signs that are there. It probably is more of a difficulty when it comes to illnesses like schizophrenia or bipolar affective disorder, etc. So I don't think very often people do sort of consider is this dementia or demon possession, because dementia is probably much more straightforward because there is visible changes in the brain to say that there is a illness here which is resulting in this person's brain degenerating, giving rise to these symptoms and signs. But I accept that there's always been this confusion in some people's mind whether some of the mental illnesses, whether it is due to mental illness or demon possession. Now that is a huge topic, interesting topic certainly, and if, I don't know whether you have read my booklet on Christian perspective on mental illness. Uh, if you have not, I will send you the link for it. And have covered it briefly, those areas of is it demon possession or mental illness, and why this confusion arises. So it is there. I don't want to sort of bring it up now because it's fairly huge topic. I'm happy to have a discussion with you personally about that.
Thank you, Dr. KG.
Thanks, Mega.
I'm reminded of one of my friend's father who was very bad in the initial stage of dementia and was very violent to the wife and all that. He was kept apart in the upstairs room. And I think as things progressed, suddenly, because he was totally losing memory, I think. And he started being very nice to this wife because he found her to be a stranger. And then during the last few years, I think they had a good time because he had complete loss of memory, nothing to accuse her of. And she took full advantage of that. And the daughter made the mother to understand, anyway, he's not remembering, so don't bring it up. They had a good time. I know what is the end of the story, but I liked that part of it where, there was something good side of dementia that happened in their family. So I don't know, does it work that way, or I don't know how bad it can get after that.
Yes, Priya, that's interesting because it can happen both ways. So you find, descriptions of people who have been very nice and people who have always been very pleasant and agreeable, changing completely and becoming more aggressive and difficult, and the other way, as you are saying. So both can happen. Personality changes that can happen as a result of, the degeneration in the brain that can happen. Yeah. So it's good. Your story that you have been you're saying is obviously had a good outcome in that the behaviors became less of a problem or challenging for that carers, but it can go the other way as well.
Thank you, Dr. KG. I think it connected
Also, yeah.
so well because I had the opportunity to look after my bachelor brother who had dementia till he died, and he was with us. And I tell you, as Priya said, I think I also had quite a few. I think I look back with as if it was a blessing. I have a lot of good memories, and I did come out with a negative feeling, though it was very challenging to look after him. It wasn't easy at all. No. But I think there were so many moments where I felt he didn't lose his goodness. He was good always, and the dementia didn't rob him of his sense of humor and a joyful spirit. So even now, when we look back, I think we have all pleasant memories of him staying with us. So I think it's how we respond. I'm not saying it's easy to take care of somebody with dementia, but I think there's a lot of lessons they teach us. And I would say that it was I came out positive with a lot of learning from my brother.
Yeah. Thanks for sharing that also. Yeah. And that's what I mean, even the the video that I showed, many of the carers saying there are challenges, but there are positive things that they have learned. And when you look back, they probably have learned things for themselves, about themselves, that we find that as a blessing. Yeah. But there are many others who talk about the other way. It's been such a difficult thing to live with somebody with dementia. So you find experiences which are very varied as well. But the point I was trying to make in what I shared was they are still human beings. They have not lost that. Made in the image of God, loved by God still, and held in the memories of God. That's not gone, remember.
Yeah, I have just one final thought, Dr. KG. Um, I live in the United States, and I have a friend here in the US. Now, her mother-in-law suffering from dementia, and both of them, she and her husband, are unable to keep her and care for her in the house because she's violent and she's very difficult, and they both are working. So they put her in the nursing home, and in the nursing home they're not caring for her properly at all, and the insurance doesn't give her chance to put her in another nursing home, and this is the only place they could afford. And when they go there, they see her soaked in urine and in such a bad state, and she's all the time bringing out angry words against the daughter-in-law and stuff like that. In fact, they want this video. So what do you advise for such people in such helpless situations? They want to give the best, but they are unable to.
Yeah, the care situation in America is very different from Australia, very different from UK, and very different from India.
Yeah,
So
too.
I'm not well versed with all the care that's available in US, but certainly it looks like you know this person now needs the care of a nursing home, and if the staff there, I mean, this is the problem. Many of the staff are people who are not well trained,
Mm.
and because the and you know the challenges trying to find people who many of them, the care workers, are maybe people who haven't got any other way of making a living. They're going into that so that they can make a living out of that. They've not been well trained. They might not have the desire to do that, and so the care that they give, there is a great deficiency in many of these nursing homes, that are being provided by the staff, the care that's being given. And so there needs to be much more input. So only thing that we can do is seeing that is when we have time. Yes, it's not going to be easy. There'll be all kinds of reactions from them to be able to spend time with them when we can, and maybe make their even though we feel they might not remember us. This is where what I was trying to say, we don't know whether they
Mm.
can remember. There might be something in us that is being triggered by the fact that you are there. They might not be able to remember your name, but very
Mm.
often till the very end they can still recognize people. You don't know what's going on in their memory and what's happening to them. So let's remember that, and then even though they might be challenging, uh, spend as much time as we can, and uh, do whatever we can to compensate for what the staff maybe are not doing or unable to do. Uh, whatever we can is all that I can suggest at this point in time. Yeah.
Mm. Maybe remember some childhood memory or something that they used to talk about, or
Yep.
something that makes them happier,
Music.
and
Yeah. Yeah.
music.
Many of them remember songs. They even
Okay.
to the very end they
Mm.
can play a
Mm.
music to them. They seem to be able to enjoy that. Yeah.
Change their
Oh,
mind. Okay.
yeah. Pray
Yeah.
with.
Yeah.
Yeah.
Thank you. Thank you so much, Dr. KG.
Welcome.
Anyone else with any other question? Otherwise, we could close the session. So please contact us in my WhatsApp number, and we can put you onto the Health Talk site and we can continue to ask questions and get care. And personally, you can reach out to Dr. Kuruvilla George too. God
Thanks,
bless you.
Ansa.
Thank you, Dr.
Yeah.
KG, so much for giving us your valuable time, and all of you BIP team for helping us, and all of you participants. So grateful that you were here, took part in the discussion, and continue to join us in the Health Talk and keep this going. Thank you so much once again. Bye-bye, everyone.
Thank you.